The best feeding choice is the one that works for you and your family. Both breast and bottle can provide nourishment, comfort, and love. Focus on holding your baby close, responding to their cues, and making feeding a time of connection. Learn your baby's hunger and fullness signals for smoother, happier feeds. Consult your pediatrician for guidance and support. Let go of guilt or outside pressure. Your love and care matter most. If breastfeeding works, wonderful. If not, that's okay too. Your worth as a parent isn't defined by feeding method. Trust your instincts, seek support, and choose what feels right. Cherish these moments. They're about more than just food. You're doing an amazing job. Breastfeeding is a finely tuned biological process. Prolactin and oxytocin drive milk production and letdown, triggered by your baby's suckling. Colostrum, the first milk, is rich in antibodies and nutrients. Mature milk follows, adapting to your baby's needs. Milk supply works on demand. The more your baby feeds, the more you produce. Feeding on demand, especially early on, helps establish a healthy supply. Supplementing or skipping feeds can reduce milk production. Trust your body and your baby. They're designed to work together. Understanding this process can boost your confidence. Bottle feeding comes with costs. Formula, bottles, and cleaning supplies add up. Preparation and sterilization take time and attention, especially during night feeds. Formula lacks the living antibodies of breast milk, so immunity benefits differ. Some babies may need specialized, pricier formulas due to allergies. Hygiene is crucial. Improper cleaning can lead to illness. Outings require planning and packing extra gear. It's a trade-off, more flexibility, but more logistics. Bottle feeding offers flexibility and shared responsibility. Partners and caregivers can help, giving you rest and allowing others to bond with the baby. You can measure exactly how much your baby eats, easing worries about intake. Bottle feeding fits busy schedules and makes outings or returning to work easier. For some, it's a necessary choice. Adoptive parents, surrogates, or medical needs. Formula is safe, nutritious, and allows every family to nourish their child. The feeding experience, love, closeness, and bonding remains the same. Choose what works for your family's needs. Breastfeeding isn't always easy. Many mothers struggle with latching pain or worries about milk supply. Feeding on demand can be exhausting, and being the sole food source is a huge commitment. Public feeding, dietary restrictions, and medication limitations add to the challenge. Emotional and physical fatigue are real. Support from partners and family is essential. It's okay to seek help from lactation consultants or healthcare providers. Acknowledging these hurdles is the first step to finding solutions. Your well-being matters as much as your baby's. Breast milk is often called the gold standard for infant nutrition. It's a living substance, changing to meet your baby's needs, and packed with the perfect blend of nutrients. Breast milk delivers powerful immune protection, antibodies, and live cells that formula can't replicate. For mothers, breastfeeding helps the uterus recover, burns calories, and fosters a unique bond through skin-to-skin contact and oxytocin release. Long-term, breastfeeding lowers risks of chronic conditions for both mother and child, including certain cancers and diabetes. The benefits go beyond nutrition. They're an investment in lifelong health and connection. Breastfeeding is remarkable, but it's not the only way to nourish your baby. Welcome to one of the first big decisions as a new parent: how to feed your baby. The breast versus bottle debate is everywhere, but the truth is, both have unique benefits and challenges. This guide is here to help you cut through the noise and make a choice that fits your family. We'll explore the science behind breastfeeding and the flexibility of bottle feeding. Every family situation is different. What matters most is that your baby is healthy, fed, and loved. Some parents breastfeed with ease, others face hurdles, and many share feeding duties from day one. There's no one-size-fits-all answer, and that's perfectly okay. Feeding is about more than nutrition. It's about bonding, comfort, and connection, no matter the method. We'll break down the pros and cons of each approach, from nutrition and immunity to cost and convenience. The best decision is the one that supports your well-being and keeps your baby thriving. Let's explore your options together without judgment or pressure. By the end, you'll feel empowered to make the choice that's right for your family. Let's begin this journey of nourishment and connection. Let's break down feeding guidelines by age so you know what to expect as your baby grows. For newborns, ages 0 to 3 months, aim for 2 to 4 ounces per feeding with 8 to 12 feedings in 24 hours. From 3 to 6 months, babies usually take 4 to 6 ounces per feeding with 6 to 8 feedings a day. Between 6 and 12 months, most babies need 6 to 8 ounces per feeding, about 4 to 6 times daily as they start solids. Now let's dive deeper into the science of breastfeeding. Milk production, or lactogenesis, is a fascinating process involving several hormones. During pregnancy, estrogen and progesterone help grow milk-producing cells in the breast. After birth, prolactin stimulates milk synthesis, while oxytocin triggers the letdown reflex. When your baby suckles, nerve endings in the nipple send signals to your brain releasing oxytocin. This causes muscle cells around the milk glands to contract, pushing milk out. Frequent feeding is key. The more milk is removed, the more your body produces thanks to this hormonal feedback loop. No matter your feeding method, always consult your pediatrician to determine the best schedule and amount for your baby. Watch for your baby's hunger and fullness cues, like rooting, sucking, or turning away when full. Prioritize your baby's health, growth, and development above all else. Every baby is unique, and so is every feeding journey. Both breastfeeding and formula feeding provide essential nourishment for your baby's growth and development. Both methods allow for love, bonding, and physical closeness between you and your baby. And both support your baby's overall health and well-being, as long as you provide care and attention. The debate around breast versus bottle feeding is often shaped by society. Some advocate for normalizing breastfeeding in public and at work. Others highlight the importance of supporting working mothers and the role of formula as a practical, safe alternative. Formula quality has improved over the years, and for some families, it's the best or only option. Ultimately, the choice should be left to each mother, based on her circumstances, health, and preferences. Remember, there's no single right answer. If you found this guide helpful, consider subscribing for more science-backed parenting tips. You're doing an amazing job.